Good morning, everyone. Thank you so much for tuning in again, our monthly BC Poultry Symposium. And we're very honored to have Dr. Denis Carrier from Merck Health Canada to present a very relevant topic, which is a topic that we've seen very commonly in most of the poultry commodities, especially long-lived birds. He is going to talk about roundworms of poultry and their control. Dr. Denis Carrier earned his DMB from the University of Montreal. Over his veterinarian career, he worked in Canada and the USA with leading animal health corporate companies, where he contributed in the areas of veterinary services, product development, regulatory affairs, and sales management. He currently provides veterinary services for poultry with Merck Animal Health Canada. This consisted in assisting customers by developing projects and protocols to improve broilers, breeders, and layer health and productions. So without further ado, let us welcome Dr. Denis Carrier. Welcome, Denis.
Thank you for your kind introduction, Gigi. So while the things are coming up here, so it should be on, isn't it? The slides?
Yes, you're good.
Perfect. Well, let's just start then. So the important roundworms or nematodes of poultry in Canada, the first one is the large roundworm or Ascaridia. It's found in the lumen of the intestine of both chicken and turkeys. Then the second worm of importance that we see in Canada is Iterachus, and it's commonly called the cecal worm, found in the lumen of the ceca. And it's also found in chicken and in turkey. The third worm is Capillaria, or called the threadworm. This one is not as common, but sometimes it shows up. It can be found either in the esophagus, the crop, or the intestine of chicken. So just to document, that we are actually seeing these three worms in Canada, what we have here, we have a survey that we've run with some of our broiler breeder customers in Canada over the last 2 years. And what we see, we've been sampling, birds every 2 weeks, like taking some fecal material and look at what worms we are finding. And what we discovered was that starting at around 12 weeks of age, we found Iterachus in many flocks. And then we also found quite a bit of Ascaridia, the roundworm, in blue throughout the rearing period. And we saw a little bit of Capillaria only in a few flocks later on in the life of the broiler breeder flock. We did not document treatment in those surveys. We just have looking at an observation of what is being found. So these flocks might have been treated or not treated. I simply don't know. But it's just to illustrate that we see those three worms commonly. We find worms more often in long-lived birds, as Gigi mentioned, but in particular, if they have access to the floor or in the barn with deep litter. In this study from Denmark that was published, what we see is we find several worms in free-range systems or organic system, deep litter system, and in backyard system. In broiler and parent system on cement and in battery cages, the chances of finding worms is much lower. So as we move more toward aviary, we'll have more. We'll be dealing with worms a little bit more often. So who can tell me what's that? Did my bird eat some spaghettis? This is the large roundworm. This is Ascaridia galli. So it was a very important infestation where adults almost filled the intestine. This is generally the most common nematode or worm in commercial poultry, both chicken and turkey. And in non-confined poultry worldwide, it says to be very, very prevalent. And it is found in the small intestine. If we cut open the small intestine, that's where we will find it. The large roundworm has a direct life cycle. And a direct life cycle means that it does not need any intermediate host to complete the cycle. So only the chicken. So eggs are laid in the litter or in the soil. And when they are laid, they are not infective yet. Oh, and I just want to mention here that I will spend a bit more time on the life cycle of the large roundworm, but the life cycle is very similar for all three parasites. So I will not repeat that for the other. There's few particularities, but I think it's besides the scope of this talk today. So we'll just go in general terms. So eggs are laid, they are not infectious at first, and then they will embryonate in the litter. In the case of the roundworm, it can take a week to a month to develop into an infective egg or to embryonate in the litter. But those eggs are in the litter, and whether they are embryonated or not, they are very resistant to every disinfectant available, and also very resistant to heat and to cold. Eventually the eggs becomes ingested by the host, and then the egg hatch in the proventriculus or the small intestine, and the larva matures to the adult stage in the intestine. In the case of the roundworm, it's the larva that causes that goes inside the mucosa that causes some intestinal damage, like hemorrhage and enteritis. But then when it becomes into an adult, it occupies the lumen of the intestine, and then eventually they mature into an adult that will complete the life cycle and lay egg. We call that period from the ingestion of embryonated eggs to the excretion of eggs in the litter. We call that the prepatent period. So that's the period to complete the whole life cycle. And that prepatent period for Ascaridia is about 1 month. So it takes about 1 month from ingestion to excretion of a new generation of eggs. So it's fast. And then they multiply. One egg will produce, several eggs down the road. So what does the large roundworm cause in chicken? It may cause, as you see, a long list of non-specific clinical signs that are really associated with the larval stage tissue damage and by the occupation of the intestinal lumen by the adult worm. We know that the large roundworm is normally found in the intestine. However, exceptionally, when we do a necropsy, or we can find it in other parts of the body. However, exceptionally, it loses its way, and it might end up in an egg or in an oviduct. And this is a picture here that Dr. Marina Brash shared with me. And this is, not a big risk if we eat that, but it's kind of yucky if a consumer does that. And it's believed that if the adult might migrate and then end up making its way up the oviduct and then being trapped into an egg. So it's rare, but it's a possibility. And the more severe the infestation, the more chances it can become a possibility. But again, I want to say that those are rare. Those are aberrant migrations. It's normally found in the intestine. Level of infection with worms are often underestimated because early larval stage cannot be seen. They're barely visible, and they remain for a long period within the intestinal tissues, like all of those larvae stage here. So maturation, and then when there is a certain number of adults that occupy the intestine, then the development of the larvae behind them become hampered. And then when you're going to treat or when they expel, that's only at that time that larvae will develop. Okay, and those larvae are the stages causing some, in the case of a roundworm, causing some enteritis and some damage. So now remember that the adults can be easily seen. However, they can only represent a small portion, maybe 10% of the total worm burden. So it's easy to underestimate worm burden, and all we see is the tip of the iceberg. We mentioned that worms produce eggs. Trained parasitologists are able to identify the species, the worm's egg. The adult female lay egg that pass a large quantity of eggs in the feces. And these eggs will stay viable in the litter or the soil for years. And they are very resistant. And as I mentioned before, normal disinfection do not kill the eggs, unfortunately. So the lower we keep the infection, the better it is. Shifting gear. What is this worm in the ceca? It's the cecal worm, or Iterachus gallinarum. It is common in replacement breeders, layers, as well as adult layers and breeders rear on floor or on free range. It's also very common in turkeys. And it can be found in the ceca, particularly at the blind end of the cecal pouches. The life cycle of the cecal worm is very similar to the life cycle of Ascaridia. And the larvae are closely associated with the cecal mucosa. And then after 12 days or so, they become essentially free in the lumen of the ceca. And that worm does not cause much problem, really. It does not really affect the performance by itself once it has reached the adult stage in the lumen of the ceca. So at necropsy, most of the adult will be seen at the blind end of the ceca. One particularity with that worm is that it's not a normal part of the life cycle. However, it is possible that an egg of the cecal worm becomes ingested by a heartworm. And then this egg will hatch inside of the heartworm and will live there alive for months. And then if that heartworm later gets ingested by a chicken or by a turkey, then it will result in an infection by Iterachus, by the cecal worm. And there's also instances where Iterachus, the cecal worm, the egg actually carries Histomonas melagridis, which is the agent of the blackhead. So if a bird ingests an egg or an heartworm contaminated with an Iterachus egg, it's possible that the turkey or the chicken gets blackhead this way. So as I mentioned, Enterachus gallinarum, or the sequel worm, do not cause much clinical sign by itself. What we are concerned about is that it possibly may play a role in the transmission of blackhead. And there's only three ways that the turkey can get blackhead. Is one, if it ingests that Histomonas directly from the feces. Two, if it ingests an Enterachus eggs that's been contaminated with Histomonas, with the agent of blackhead. Or three, if it ingests a heartworm that's had an Enterachus egg that is contaminated. And the signs of blackhead are very severe, in particular in turkey. So Enterachus and Ascaridia eggs are very, very similar, but trained parasitologists are able to differentiate them. Now, what is this? I don't really see much, really. Do you? So this is the threadworm, Capillaria. So there are different Capillaria or threadworms that are found either in the crop, the esophagus, or the intestine. And then based on where they are, that will determine the clinical sign that we'll be seeing. The Capillaria are very difficult to see. So really, in order to identify them, we have to do a scraping. And then we can put the content of the scraping on a slide and look under a microscope. Here, what we have is a larvae of Ascaridia from a mucosal scraping seen at the 100x magnification, but an adult Capillaria would look very similar. Also, another way to identify Capillaria without using a microscope is to put the scraping into a sieve similar to that one that we see here. And then we flush the cellular debris with high pressure water, and then the worms get caught on the top part of the sieve. And then what we do is we turn the sieve around and then flush it, backwash it into a clear jar, and then we can visualize the worm in the clear water. So here we see the little threads floating. So that's another technique that allows us to identify threadworms on necropsy. Capillaria may cause different degree of enteritis dependent on the severity of the infection. But it's more like really, I don't think we get that severe of an effect here in Canada, but in the US, I know they do. And the eggs of Capillaria are very characteristics. They have those two plugs within each extremity, and parasitologist says that they have a reticulated pattern. So they're smaller eggs compared to the Enterachus and the Ascaridia, and they have those two little plugs at the end. So that's how we identify Capillaria. So we talk about three different worms. What's our problem? What do we see? Do birds develop immunity against worm, or is there some natural resistance to worm? So just want to make a quick mention about that definitely young birds are more susceptible to worm infestations, and partial resistance develop with age. So that's true. However, the key word is that it's partial resistance. Even an adult that's seen worm before, there will be some worm that will develop. However, with immunity, it's possible that there's going to be less worms, or that some people have suggested that it's possible that the worm won't be as prolific, or won't grow to be as big. Now, sometime also in the presence of immunity, the development might be arrested at the third larval stage. And then at a moment of stress or vulnerability, then the development of the larvae can continue, and then you can get develop into adults this way. Some studies have shown that a good nutritional state is important to reduce the impact of worm burden. And there's been work in particular with looking at protein, vitamin A and vitamin B complex, calcium, and then lysine. But so I guess a general commercial food that we have takes care of all of that. And of course, healthy, immunocompetent, well-vaccinated birds kept in optimal conditions will always do better also. When I talked about the 3 different worms, we talked indirectly about diagnostic, but if we want to make a diagnostic and establish that we have a worm infestation, we have 2 major ways that are practical. The first way is opening the intestine in necropsy. And then the second method is to look for parasites, eggs, in the feces. And there's different techniques that are used, but for the lab, the most common technique that I've known that they're using, we call it a fecal flotation. And trained parasitologists are able to identify eggs that way. And also we can count the eggs and score based on give it a score of low severity, medium severity, or high severity based on the number of eggs that are seen. Now, remember that there is limitation, because in necropsy, if we don't see adult, or if we see 1 or 2 adults, remember that we only see a small percentage of worms, only 10%, if you remember, of the worms are adults. So there's much more larvae and different stage of larvae in development in the intestine. And as far as limitation of the fecal, is that it's possible that I have a worm infestation, but if I don't have any laying adult female, there will not be any eggs in the litter. So sometimes it's going to be negative, and in fact I have an infestation. So doing those looking in the feces is not a very sensitive method to detect worm burden. So when we see a little bit of eggs, it's an indication that there's a good infestation. So I take it seriously when we find that, because there's not always they don't always shed. Also, maybe in the future, there's been some publications suggesting that maybe in the future we'll be able to look at infestation using some serology, but to my knowledge, that is not commercially available anywhere. Okay, we talk about eggs. Now, I've kept my chicken or my turkey free of worm all along, or I have a brand new barn. And then I have parasites. Where do worms come from? Well, these, like Ascaridia in particular, it can it does not infest or infect only chicken and turkey, but it infects many types of birds, Ascaridia in general. And then there could be eggs anywhere in the soil, in the environment. And then there are vectors that might just, the eggs are sticky. And those vectors like flies, rodents, beetles, artworm, they can actually carry those eggs on their legs, or on their not skin, but on their cuticle, or on the egg side. So just acting like a mechanical vector, just like our boots, our equipment. So those are all ways where parasite eggs come from, even in a brand new barn. So that's where biosecurity plays a very important role to keep worm burden very, very low. Just a word here, there's that word, parotenic host. Parotenic means that it can be a host, but it can just carry the parasite. It does not mature or does not play any role in the development of the parasite. When I talk about the cecal worm, for example, that can develop into a larvae in the artworm, in that case, the artworm can be an intermediate host to the cecal worm, but it can only be a parotenic host to the Ascaridia, for example. So yeah, so all of those worms, as I mentioned, they have a direct life cycle. They don't need any intermediate host to develop. So that's why it goes so fast, and that's why it's so common. Prevention, we touched on it. Biosecurity, biosecurity, biosecurity. The nematode, the worms by themselves don't travel far, but their vectors may. The rodents moves around quite a bit. There is studies showing that, and of course flies. Cleaning and disinfection, heat can proven to be the most effective, but even huge amount of bleach, you know, the amount it takes would not be practical, but that would have an effect. It's been demonstrated against the cecal worm larva. Not the egg. Some people have suggested to salt the floor, like they did that in the US, but the data says it's not effective. Really, no disinfectant are known to be effective. One thing, though, that we can do with washing, cleaning, disinfection, and then mechanical scrubbing is to, you know, if we do a hard scrub, there's a chance that we're going to reduce the number of those eggs that are sticky and that in between the cracks and that be there. We cannot guarantee that it's going to remove 100% of them, and we cannot really measure how much has been removed, to my knowledge. It's not like for bacteria and viruses, but it's reasonable to think that a good scrubbing, if we take the time to do that, it would reduce the load of worm eggs, should I say. Yes. Now, going into treatment. So one treatment approach that has been used is to treat empirically based on historical health record and based on the different worm pre-patent period. So the pre-patent period, you remember, is that period between the ingestion of an egg to the time where we find eggs that have been laid by an adult female. So treating once a month would kill most adult female roundworm and cecal worms before they could lay and contaminate the environment. And then people would start that at a time where they have traditionally seen the infestation starting. If your primary concern is Capillaria, then empirical treatment every 3 weeks could be a consideration. However, this is not the most common way that things are done. The more common approach that we see is to do regular fecal tests and to treat once its infestation is confirmed. And then we treat to try to reduce the burden of the specific worm that we find. If we want to try to reduce the burden of sickle worm, that's good. It might, it will not completely eliminate the risk of blackhead, but it may reduce the incidence and the severity. So deworming is not a treatment for blackhead. I just want to mention that. So what we have here, different eggs, Ascaridia, Heterachus, and Capillaria, so a bit of the difference. So we talk about roundworms in poultry because they have an impact on overall health and productivity. Of course, we are lucky. We in our production system traditionally, in batteries and on short-lived birds, on cement or wood floor, really we don't deal with worms a lot. However, as we move to more aviary type or more backyard type of situation, there is more worms that we will see. And it's important to talk about roundworms because they have an impact on overall health and productivity. We may have intestinal inflammation and enteritis, resulting in poor performance and immunosuppression, potentially increasing susceptibility to other common disease such as coccidiosis or bronchitis. People that buy eggs from small producers or organic or situation like that, regarding the rare presence of a worm in an egg, Disease of Poultry states that presumably the worm migrates up the oviduct via the cloaca with the subsequent inclusion of the worm into the egg. And there's been cases where companies have received complaints and threats and lawsuit threats when there's been worm found in an egg by a consumer, which is kind of embarrassing. So should we treat or should we not? And then why treating? Because maybe that infestation is low and my productivity is good. So there's documented effect on immunocompetence, welfare, and productivity. So in that study here, there was some increased prevalence of secondary bacterial infections such as E. coli and Pasteurella. Documented effect on the behavior, so welfare aspect, and growth and feed conversion in other publication. And deworming prior to exposure had a preventative effect on blackhead in that publication. So can reduces some other disease. The one that I was a bit surprised was about the food safety. So some authors have reported that large roundworms influence rate of colonization and excretion of Salmonella enteritidis. There's also a report suggesting that Ascaridia eggs served as a vector of Salmonella. So that's kind of interesting. Other data, helping us to decide whether we should treat or not. This was published a few years ago, and what they had done is they monitored worms, the mean number of ailments in all of their farms, in all of their growers. And then what they did is here what we have is that we have the grower rank. So the top tier, best growers is rank 1, average grower was in the tier 2, and then the lower tier grower that has traditionally the lowest results were grower type 3. And what we have here is we have the worm infestation with Ascaridia, Enterachus, and one of the Capillaria obsignata. And then what we have really, what it shows is that there's a trend here for, we have, the tendency was for lower production with those producers that have a higher worm count. So there was no statistic here. It's only a trend, a correlation, but that I thought it was interesting to bring it up. So these were, I believe those were brawlers in the US. So as we get toward talking about treatment soon, the general principle about prevention and control, of course, is to have confinement housing, all in, all out, to minimize parasitism. It's important to bring in parasite-free pullets and poults when we move poults from the brooding to the growing area. Changing boots, basic biosecurity principle, because we can bring worms with our boots into a barn. Any other mechanical vector, whether it's a vermin or whether it's equipment. Sanitation can play an important role to try to break the life cycle. Always feed and vaccinate for optimal immunity. I don't think it's worth cutting corners when it comes to feeding and vaccinating for optimal immunity. And of course, once we are dealing with a confirmed infestation, we have to consider deworming the flocks. And then what treatment strategy? I talked about treatment strategies before, but here there's a data that looked at evaluation of 2 deworming strategies. And then there was a negative control. The UT group was untreated. CT was the conventional treatment. And in that case, the deworming was initiated based on a predetermined time. And that was based on their historical clinical information. So it was just treatment at a certain time. And then there was a third group with a targeted treatment. So the deworming there was initiated when the egg count crossed a predetermined threshold of 200 eggs per gram. So pretty low level of infestation. So the trial design, so we have our untreated group here, and then the star that represents the time where birds were posted to look at and then collect the whole intestinal content. The circles are where there was fecal or manure taken to do egg per gram count, and the black arrows were when they were treatments. So untreated group, there is no black arrow. The conventional treatment, they were treated once at 27 weeks. And then the targeted treatment end up received 3 treatments. So let's look at the results here. So we have our first group, the untreated group. We saw the worm burden that kind of progressively came up, but then stabilized at a certain level. So presumably, they reach a certain, after we reach the worm load reaches a certain level, it's stabilized and it stays stable at that level. Then the next group is our conventional treatment group, and then we saw that at 27 weeks after the treatment, when they treated, we saw that the egg per gram count came down, but remember here that litter had been contaminated for quite a while, by those eggs. And then shortly after the treatment, the infestation came back up, and they finished with a very similar infestation than the group that had not been treated. And then we have our third group. Oh, so that group was treated once there. And then we have our third group. When the egg count reached above 200 here, they were treated here at 22 weeks, again at 28, and again at 36. And overall, the worm count was kept low. So the control treatment resulted in EV parasite egg contamination. We leave the next flock with a lot of contamination and potential problems. What they've shown is that the targeted treatment can limit overall environmental contamination of Ascaridia eggs. And then it kept the worm burden low during the whole production period. So, and we know that lower burden correlate well with improved performance. So that would be a desired approach to take the effort of taking regular fecals and then treat based on what we see. And that might mean more treatments or not over time. So what treatments are available in Canada? We have two products that are approved to deworm poultry. We have fenbendazole product and we have piperazine products. Fenbendazole, the mode of action, it interferes with the energy metabolism, resulting in the death of the worm. It also has a dose-dependent effect on adult and immature stages. And at certain doses, it might have an ovicidal effect on the nematode eggs. So meaning that female won't produce as much eggs. Or even if the female is not dead, the eggs won't be as viable. And the other product available is piperazine, and piperazine only paralyzes the nematode, and then the worm is expelled by the normal peristaltic action of the intestine. It is said that as the concentration decreases down the intestine, the motility of the worm may be regained. So this table summarizes the labels of the different products that we have on the market. So there are two fenbendazole products, Panacur Aquasol and Safeguard Premix. And then there is a few piperazine products. Panacur Aquasol is for chicken, given in the water, and it has label indication against Ascaridia and Enterechis. Safeguard as a label for turkey. It is given in the feed and also as a label indication against Ascaridia and Enterechis. Piperazine, different formulation can be given to chicken, turkey, via water, feed, but they only have an indication against the roundworm, against Ascaridia. If you have question about using Panacur or Safeguard other than by label indication, you might ask your veterinarian and they might be able to provide some information to you. So Panacur Aquasol is for drinking water, proportioner, and bulk tank. There is no withdrawal or on egg or on the meat if it's used as indicated. The formulation, the particles are very, very small, like it's produced with a micro milling process. So it doesn't plug the water line, like it's a very good suspension. We talked about the approval for Ascaridia and Enterechis, and the dose is 1 milligram per kilo body weight daily for 5 days. Safeguard Premix is fenbendazole through the feed. It's for the treatment of roundworm and cecal worm in growing turkeys, so just growing turkeys. And it's fed for 16 ppm for 6 days. And there is a withdrawal of 24 hours on turkey meat when that is given. There are several tools available to help you with the dosage and calculating the cost. So there's a Safeguard app that's available on the App Store or Android. There is a dosing table that we can provide. And there is also, like for Panacur Aquasol, there is a specific method to follow when you prepare it. It's important to follow the instructions. So you can ask us for that little cheat sheet, or we can discuss the details. So in a nutshell, we have Safeguard for growing turkey. It's to be fed as a sole ration at 16 ppm for 6 days. It was determined to be safe when 400 ppm was given for 18 days. We also have Panacur Aquasol. This is for chicken, given via drinking water for 5 consecutive days. And it was determined to be safe when 5 milligram per kilo were given for 15 days. And then the withdrawal are mentioned here. So in summary, what we talked about, what are the roundworms of poultry, and what about their control? Well, what did we talk about? We talked about 3 worms, and Ascaridia and Entericus are the most important and the most common for us in Canada. When is that happening? We talked about the life cycle and the pupating period, so that's important to determine timing of our interventions. Where do they come from? We talked about that. It comes from the litter or the soil. Why bother talking about worms? Because they have consequence, and if we don't handle it, it means a high burden for the next flock that's going to be coming up, and there are some severe consequence. The most severe being blackhead with sequel worms. And then we talked about treatment and prevention in terms of how to control roundworm infestation. With this, I really thank you for your attention, and I would welcome your questions or comments.
Thank you so much, Dr. Carrier. I felt like I learned a lot myself too for that very thorough presentation on parasite control. And if any of you guys have any questions, there is a Q&A chat box at the bottom of your Zoom app. And feel free to type in the questions. And maybe I'll start with a question. It's just want to get your general comments that I noticed that you cover roundworms, Capillaria, also cecal worms. Tapeworms is another common parasite that I generally see in the day-to-day practice. Like, can you comment on that too? I generally just treat them with Panacur as well, even though they're not on label. There's not a lot of options. Like, maybe I'll let you comment on some tapeworms in case our audience is not familiar with it.
Right. It's interesting, Gigi, like when I prepared the material, there was some material on tapeworm. I took it all out because I was not aware that we see tapeworm in commercial poultry. And I would need to search it up actually, because that has not come up as a question either that I received. How do you handle it?
Oh, thank you. I mean, I see it occasionally in commercial flock, like broiler breeders and layers. Although every time I see tapeworms, I almost always see it together with roundworms too. And then sometimes I see it pick it up from like a cecal cytology. The treatment that I do would be the same in Panacur. Occasionally in backyard flock, when I see it, I tend to dose it a little bit higher. With Panacur, not finding much more information, and has some anecdotics like report of like dosing it a little bit higher. So yeah, no, right. Thank you.
No, thank you. The dose I don't remember seeing dose titration study with Panacur and tapeworm. I would need to look it up, but I know that our dose titration study, like for Capillaria, like those we have well documented, and we know that we need a higher dose to get Capillaria. But because I don't know the audience here, Gigi, I don't want to talk about too many off-label things.
Absolutely. No, thank you. I think you covered most of them. Let's see if we have any other questions. Beth has a comment, and she just said, thank you. It was very thorough and learned a lot about worms and poultry. Yeah.
Thank you.
Let's see if anyone else. Okay, all right. There's another question. How can we remove the worms and their eggs using mechanical ways?
Once in the egg, it's there, you cannot remove it. The difficult thing is that sometimes it is missed at candling. It's not depending on the position and so on and the size. Sometimes it is missed. Now, if you crack an egg at home from your own backyard chicken and you see a worm, you just, in theory, I don't know if I would eat that egg. My wife definitely would not. But in theory, they say like as long as you don't eat that thing, there's that worm, there would be no concern. But once it's in the egg, there's no way you can remove that. And the difficulty, like candling does not always pick it up. I'm sure it picks it up sometime, but I've been told by like large commercial company that it's a real headache. Like even if they do their best, and sometimes it gets missed. So there is an increased emphasis on deworming in those birds that are raised either organic or in aviaries, because it has happened.
Absolutely. Once it's in the egg, it's really hard to get rid of. Like, yeah. What about the worms and the eggs in the environment? What are some mechanical ways that you suggest, like removing them? I know, like, for example, cecal worms are particularly very sticky. I think you mentioned about scrubbing on your presentation, and any other things to add in terms of that?
That's pretty much it. Like some people, will take off a layer of soil and put something new on it. Of course, if we reuse the litter many times, like deep litter, if we remove it, that also helps. It's one of those things that if we can keep the flock to flock burden low, like over time, we'll have a lower burden, and we see it, right? Some farms, some places, it just seems to be cursed, while other places we never see any. We don't have the problem. So attention to detail, persistence, and try to keep flock to flock burden low. Those are the way to do it.
Right. Some elbow grease, essentially, eh?
Yeah.
Great. All right. Any other questions? We have a couple minutes left if anyone has any more questions. Otherwise, well, thank you so much again, Dr. Carrier, for such an informative, like practical presentation. I'm sure our audience had learned quite a lot from you. And once again, thank you, our sponsors as well. Without you guys' support, of course, it's going to be very difficult for us to put the monthly webinar together.